because especially these days, medications can be quite expensive, and a lot of the heart failure medications may not be available as generics, so they can get quite costly. So even if normally a person would have to take only 1 or 2 medications, for many of our patients, they have to take a lot of medications every day. And we're aware of this, so it's important for us to know if that's a concern for you, because we can definitely find ways to try and make the medications more affordable. So there are a lot of different ways that we can be creative about helping people pay for their medications. For starters, if you tell us, there are sometimes ways that we can prescribe generic medications, or we can choose different medications from the same class, and they may be just as effective. There are also other resources that people can use to get their medications for less expensive, so there are always ways to work around cost. Patient assistance programs are programs that are designed to help people work within their budget to get the medications that their doctors want them to be taking. We can actually work with the pharmaceutical companies, or we can have people connect directly to the pharmaceutical companies so that they may be able to get them on payment plans, or may actually be able to work something else out with them. Mail order pharmacies are a nice way to save on costs of medications. Very often, if people use a mail-away pharmacy, the same medication will be less expensive than if they pick it up from their local pharmacy. If you know that you're on something for a long time, sometimes it can actually be less expensive to prescribe it as a 90-day pill than a 30-day supply of pills. It's really, really important for us to have you know that if you are concerned about the cost of your medications, and that's what's standing in the way of you taking your medications as prescribed, we can help you with that. We want to make sure that you can take your medications regularly and not skip doses to avoid things like unnecessary hospitalization or worse. There are always creative ways that we can help people to save on the cost of their medications. So it's really important to talk to your doctor or your other healthcare provider to figure out if there's something we can do to help you.